Go ahead, Christina.
The hard thing that we're running into is, not all front offices are treated equally, and the people at the front all have different types of training. So we have some individuals at the front office that might be cross-trained. They might be somebody who runs to the back, flips the room real quick, or if an assistant is ill, or they're not afraid to step in, and they've been trained on, bloodborne pathogens, and they've taken the appropriate OSHA trainings for that. We also have some individuals in the practice who have never crossed, contaminated. Yeah, exactly.
Right.
And they might have even, sat in our OSHA trainings. I typically usually recommend that everybody attend OSHA trainings because you never know when situations like this might happen. But if they haven't, taken the OSHA training and they haven't done bloodborne pathogens, then they don't really understand the risk and, how to put a mask on properly and the gloves and how to take them off properly. And so that conversation needs to happen with them specifically, because as a hygienist, it might be really easy for me to be like, no way, I'm not going up there. You stick a mask on, you take their temperature, it takes 2 seconds, versus me taking off all my PPE. But what we really want to be aware of is the abilities of each other and having these conversations. There's no right or wrong. It's just about creating a flow for your practice that's going to be best practice.
Right.
And we talked about, ideally what would be amazing would be having like a floater assistant who, if you have time and you're not, scheduling like you normally would back to back, that you have somebody who can come up and be the person who takes the temperature and walks the patient back. And they're not the ones that have to get fully garmented up to go into the operatories. They would still stay outside of the operatories because that's where it gets hard.
And so what we're really talking about, I mean, I know there's so much discussion around it, but what we're really talking about right now for most practices is whether they're in the reception area or they wait in their cars, that we've asked them the appropriate questions, and temperature and hand sanitizer. That's the main thing that we have to figure out for our practices, and then get them hopefully from the front door to the operatory in the most efficient manner. Am I right on that?
Yeah, and there's a few other there's some other considerations too. So as Christina was saying, with the waiting room being kind of like a public area, we want to make sure that we're also wiping down the surfaces that are there. So this is going to be a different frequency than what we're used to. It might have been something that we did at the end of the day. We just kind of went through and tidied up and wiped things down. But now it's really to make sure that we're eliminating any potential risk factors that are in the waiting room for our patients as well. So having someone who's able to do that periodically throughout the day, multiple times during the day, to be able to wipe down the public restroom if there is one in the reception area, to be able to wipe down the chairs, the table. And once again, that's something that you want to be trained in, because all of our products that we're using for disinfection or cleaning have instructions for use. So it's not simply wipe it down and everything's clean. There's waiting time periods and each one is different. So having those trainings as well. And that's something with OSHA standards that should be implemented in office. There should be a training. You should be trained in the cleaners that you're using, any chemicals you're using, the PPE that you're wearing as well, and what your risk factors are, to make sure that we're all aware. And then it's making that best decision based on our practice, what the flow is. You may have an area where patients enter in a separate exit, which is going to change what that process looks like for check-in and check-out versus one waiting room.
Right. And so I don't know if you've seen it I've seen it on all the social media, but there's that long kind of motivational, I don't know, where are we quote out there about that we're not all in the same boat, that we're in the same storm, but we're all in different boats. And like Christina mentioned earlier, I mean, different states have different rules. It's going to look different this week than it does 3 weeks from now. Things are going to change on a regular basis. I mean, my gosh, who knew we were going to be here right now? So the most important thing, like Chastity was saying, and that I agree with 100%, is know your boat. Figure out what you guys are going to do in your boat, like what's going to be your processes. And training, I think, is huge. I'm personally thinking, like, I'm back and forth. I've been on all these discussions, like, how do we do this? When we first started, I was like, no, the front office team shouldn't do this. And now I'm like, okay, I can see it, but what's more important to me is that everybody's trained so they understand why we do what we do and how. And then secondly, that I think having somebody responsible, whether it's one person from the front team or one dental assistant or having somebody whose job it is to check the patients in, disinfect the reception area, the front desk, and all of that. I mean, and then basically it's just a matter of every day, and Christina, you and I talked about this earlier, so please speak to this. Every day is going to be a new day. Every day things are going to change. So how do we know what's going to happen 3 weeks from now? And how do we make sure that we're adapting accordingly?
I think it's really important right now to have empathy for each other, but also our own selves, like knowing that we are all in this time of uncertainty and we are used to having schedules and routines and sticking to it. I mean, a lot of us hygienists, I'm speaking about myself, maybe you're not all this way, but I'm very type A and I've got my structure and I like my schedule to go a certain way and I've got a rhythm. And so now I'm completely out of rhythm. There's a lot of unknowns. There's a lot of times where I might mess up, where I might accidentally touch the outside of my mask, where I might accidentally walk to the front to go ask them a question wearing my gown. Now, what do I do? And being okay with that, accepting that in advance for each other, I think is really important, because maybe you're the person who doesn't mess up and the other person, they might not quite understand the protocol. And so they might be more apt to make a couple of mistakes. But having that space for each other to be able to mess up a little bit is going to be really important during this time, so that everyone knows that they're still accepted, they're still appreciated, that we're all going through this together, and that we can openly discuss this without it being reprimanded or anything is so important, because what works for today might not work tomorrow. And it would be great to be able to end the day every day and say what worked, what didn't work, what could we do better, without feeling like there's any blame or shame in this situation. Because when we're fearful, we usually blame. And so we don't want to create any of that blame. We just want to be able to have this learning experience and look at it like an exciting learning experience where we're going to figure this out. Let's go in it the best that we can. Let's have our protocol the best that we can, that we all agree on. And if we got to tweak it, we're going to tweak it.
Exactly. And one of the things that I try to remind people is it's almost like we're all starting a brand new job on the exact same day. We're all starting something brand new. Like maybe you're an amazing hygienist or dentist or assistant, but we're all coming into a brand new environment with new expectations and new rules, and they are going to change on a daily basis. So make sure when you adapt and change, and we allow for that, that everybody, whether they're in the office or not, your entire team is kept up to speed on that. So Chastity, we were talking about before, like, what about the things we don't plan for? Like, what about the parent who has to bring a kid in, or somebody who wants to sit down and have a cup of coffee? Like, what are some thoughts around it, and how would a team adapt for something like that?
Yeah, I mean, right now we're trying our best to create some version of organized chaos, really, is just, and we're all looking for that black and white structure of like, okay, like this is what has to happen. But there's so many scenarios that we really won't have control over. I know I've heard several of my family members and relatives even say, gosh, I was in the grocery store the other day and someone came in and they didn't have a mask on. Like, how could they not have a mask on? Like, don't they know that that's how they protect us too? And though the masks are recommended, we have to know that there's also exceptions to that rule. So if you're 2 years or younger, you don't necessarily, it's not advised to have a mask on because of suffocation and safety concerns. If you aren't able to remove a mask on your own, or if you have a breathing condition that makes it harder to be able to breathe if you then have a mask over your face. And so really kind of trying to troubleshoot through those what if moments. Like, we don't want to get too out of control and like think of like the most worst case extreme scenario of what happens, but at least having a backup plan for what if someone does come in with a relative that maybe they need to be present there based on age or a care factor. There are guidelines that are accounted for this. So if you're bringing somebody else into the treatment room, they should also be wearing a mask and a shield, making sure that we're kind of having those conversations, trying to anticipate them. So when we're doing those phone confirmations saying, we're really trying to limit the amount of guests that are in the office at the time of the appointment. So please be advised, we're only allowing one person to come in. You'll have those exceptions that kind of also bubble up, but trying to just anticipate where things might not be so black and white, and being empathetic and understanding as to why those are considerations.
Right. And that's great. And Christina, what are the thoughts around like we are all seeing all the Facebook groups and all of the this is the way, and this is, I'm a hygienist, or I'm an assistant, or and my thing is we need to be focused on the patients and our practice in general. So how can we make sure that we're really focusing on this, but not too much, and putting our patients first, putting each other first? What thoughts do you have around that? Because that's really what we need the mindset going back into the practice to be.
I think it's really important right now to focus on, how can you still create a memorable experience for your patients is what we want to ensure. So there's going to be lots of unknowns, and there's going to be lots of, different opinions within the practice as to who should do what. And, do we like CDC or ADA or OSHA's guidelines? Who do we like better? Which ones are we going to adapt? Which ones are we not? But in the end, we want to feel like, okay, when the patient comes in, we don't want to be having those moments of like, I don't know what to do here. I don't know what to say. I don't know what to do. And everything just freezes, where we're just like a deer in the headlights and we go into fight or flight mode. And we might have those moments still, but the more conversations we can have as a team, the less likely it is that this is going to happen. The more that we can practice the what if scenarios. I think a lot of times when we have conversations with each other, we don't bring up the what ifs because they're so, hypothetical. Like, why are you bringing that up? And I think the more what ifs you can come up with, the better, because you can be prepared for chaos. Like Chassie said, prepare for chaos, prepare for worst case scenario. Your patient comes in 30 minutes early and wants to sit in the waiting room. What do we say? Your patient comes in 20 minutes late and thinks that you should still be able to see them because it's scheduled for an extra 30 minutes anyway.
Right.
What do those conversations look like in advance so that we can ensure, if somebody walks in or anything, like what are these conversations going to look like so that we're really prepared for all of us to say the same thing? When patients ask, why are you taking my temperature? Why isn't she? Why are you wearing that PPE and they're wearing this? There's lots of conversations that are going to come up, but create those experiences as much as possible. You mentioned going to the medical provider and having it really like them repeating the same thing over and they're just dragging it out. We don't want to become like that either. So still being upbeat and having great tone and be excited that your patients are coming back into the practice. You don't need to apologize for asking these questions. This is just part of the national standard right now. This is the norm, even though it doesn't feel normal. So just say, you've had these questions asked before. I'm going to ask them to you again. And I know you already said no, but let's just double check. It helps us all, and then take their temperature and that's it. And if you are choosing to wear a mask as a front office administrator, still smiling with your eyes, still smiling with the tone of your voice, still creating connections. You know their name. You didn't forget who they were. They're not this contagious person that you've never, met before. Ask them how the kids were. Still connect with them. Really create as much normalcy as you can for your practice so that the only difference is that you guys might be asking more questions, taking their temperature and wearing some PPE, but otherwise it feels like the same place they've always been coming to.
And honestly, if you haven't thought about it, what I've been talking a lot about is we're going to have a soft reopening. It shouldn't be coming back full bore, light switch on, let's go. So there's going to be more opportunity. Yes, there's more steps, but there's also going to be more opportunity to build that bond again with the patient, to give that a little bit of extra attention, because we should be building in a little extra time for that. We shouldn't be double booking. We shouldn't have the reception area full. So Chastity, do you have any other thoughts about like I know, there's they can do it. Well, it's their job. Well, but we all have to come together on this and figure out what's best for the practice. Do you have any other thoughts about that when they're trying to figure out what works for their practice?
Yeah, I think that's the biggest thing is we have to come together to be able to have these conversations and really having an understanding for how is it that each person's role is changing. We don't need to have like the extreme in-depth, like step by step of like what exactly is happening in the operatory for everyone, but at least like having an understanding of how are we shifting our practice, what is it that we're able to do or not able to do. What are the precautions that we need to take regarding minimizing any kind of cross-contamination? It would be best if the front office team, they are so motivated and wonderful, but we don't want them stepping into the operatory right now to be able to do any kind of like estimates or quotes like that. So being able to just come together as one to have the conversations about how our roles are changing and what makes the most sense within our practice, where we can get creative and think of other resources. Do we have that free assistant? The best thing to do is really just always approach it from more of a question standpoint instead of having like a complaint, like, I don't want to do this, or this person should do this, they should be able to do it. But more so approaching it as like, how can we achieve this with the least amount of stress for everybody? Like, what are some creative ways we can make this happen? Is it having patients take their own temperature? Is it having an assistant that's a runner? Like, what are other ways versus just kind of the typical like 2 options?
Right. And one of the things that I'm doing at Front Office Rocks, and if you guys love Chastity and Christina, you'll want to come over to Front Office Rocks because we're going to have more conversations like this, and they have lots of training on my website. But one of the things that we're really talking about at Front Office Rocks is it's not going to be the same thing next week, the week after, the week after. We've got to adapt, we've got to grow, we've got to learn, we've got to be open. We have a Rockstar Restart program where I'm literally learning. Like I saw these guys speak last week and I went, oh, well, we have different opinion. Why do you think that? Why do I think this? So I think you should do the same thing with your team. Get your team together and say, what do you guys think? And it's not one person's more important than the other, or one thing is more important. It's all of us coming together for the focus on the patient. So I really appreciate you guys kind of opening this discussion. I think when we get quarantined, we get into this, like, we're all by ourselves mode. And it's time to get out of that all by ourselves mode. And I know there's lots of questions out there that are unanswered at this point, but coming back together as a team mode. Do you have any other final thoughts, Christina? Anything else you'd like to add as a motivational end to this few minutes of talking about it?
I think what you just said is perfect. You know, we've been in this quarantine, we've been feeling like we're alone. And when we feel lonely, we retract even more, and it validates that loneliness. So now is that time to start realizing that, okay, I'm going to be working with my team. Think of it as a restart button to say, okay, you know, we maybe didn't communicate well before. You know, maybe communication was different or difficult, and that's okay, because moving forward, we're going to create this space for each other. And if you can consistently create space for each other to have opinions and views and perspectives without any judgment, you're going to notice a huge shift in your relationships. So even if you start that, if you start the one that creates the space for people to have a differing opinion and welcome differing perspectives and opinions, it's okay, because there's so much uncertainty. We all have been going through this storm, but you know, it's been different for every single person, and just accepting that as is, your relationships and your team building experience is going to shift drastically. And I think there's a lot of good that can come out of this.
That's awesome. And Chastity, does this have to be started by the doctor? Is this have to be a conversation like, I mean, you were just saying, like, we have to be open. What are your thoughts for the team and the doctor and whoever you are in the team to say, we really need to figure this out? What are some thoughts that you have around that?
We completely believe that anybody can step up to be that leadership role. So any person within the team can lead and start a conversation. It just really takes the commitment to want to take something and make it better and shift it in a positive direction. So anybody can have that conversation. Anybody can bring it up. And especially with being compassionate with your team members, like, we're all in a fearful mode right now. And like Christina was saying, we all tend to pull back, but absolutely anybody can just kind of pause, reach out to their team members, see how they're feeling, how they're doing, what they've heard, what they need to feel comfortable, and try to navigate ways to find those resources or to create those policies that accommodate everyone's concerns at this time.
I think that's great. So if you loved this, you want to go to YouTube and check out the Dental MVP, Mind Body Practice. Christina and Chastity are amazing. And I know you have some COVID specific videos on there and adding stuff. Front Office Rocks, we have a lot on YouTube. We have a Rockstar Restart program that we're going to have this interview or conversation plus many more on there. And we've only talked about the check-in process. We haven't even talked about the check-out process. Like, how does the patient pay? Who reschedules them? So that's going to be our next topic. So join us next week. We're going to be live on Facebook next week, we hope. We had some technical issues this time. So and we want to hear from you guys. What's the conversation going on? Like, we can't go find the PPE for you, but we can talk about what's required or who should wear what or how to train our team. And that's really what we're here for. So thank you for joining us. Thank you guys for joining me today to have this discussion started for our industry. And if you guys need anything else, please put in the comments if you have some thoughts or things you'd like us to talk about. And if not, have an amazing day. Thank you guys.